Addison and Cushing. This goes in what system? Endocrine system. What gland is affected and what is the gland is responsible for Addison and Cushing? Adrenal gland. And what part of adrenal gland is? Cortex. Adrenal gland has two parts, cortex and medulla. Addison disease is from what gland? Adrenal gland. What part of adrenal gland is? The cortex. This adrenal gland is responsible to producing, we say the word is steroid. The word I want you to remember is glucocorticoid. Everyone make sure we know glucocorticoid. Mineral corticoid. Androgen. So what is a glucocorticoid, mineral corticoid, and androgens are from adrenal cortex. What is Addison disease is the adrenal gland. What part of adrenal gland is the cortex? What is it producing here? The steroids. And what are the steroids? Are glucocorticoids. Now what happened to the patient when you have Addison? Number one is they have low sodium, low sugar, and low blood pressure. And what is high here is the potassium, and what is high here is the calcium. Our adrenal gland is responsible for electrolytes or vital sign, maybe in your question. Now let's memorize adrenal gland is responsible for what? To maintaining your electrolytes and maintaining the vital signs. So what are we looking for? Electrolytes and the vitals. Now what is high here, which is not too good for your patient, is potassium. And what is low here is sugar and very low sodium. Question. Patient, you're a nurse, you're admitting Addison patient. What would you monitor as a nurse? Simple answer. What do you monitor here? The blood pressure. Maybe the answer is what? The vital sign. So remember, first thing is what are we monitoring here? The blood pressure. Second thing is Addison patients are losing weight. You've got to monitor their weight. So remember, they're losing weight. What would you teach your patient who has Addison disease? Number one, you prevent them from a stress. So what would you teach them? Avoid a stress. That may be your question. Because if they go in a stress, their steroids are very low. And so number three, I would say everyone remember the word, what are we avoiding here? The stress. Now what happens if they're going in a stress? Anytime when we get sick, we are going for surgery, your body needs more medication. Are we clear? So stress, infection, surgery, but a lot of in your question would be, so how do you treat them? By giving mineral corticoid and Florinef. What do we teach our patient when you're giving steroids? Don't stop all of a sudden. What do you have to do? You have to taper it down. When you're going to practice your question, what would you treat your Addison patient? Answer maybe Florinef, maybe mineral corticoid, maybe you're giving us steroids. Now what happens if you stop it? Patient is going into what? Crisis. Addison or adrenal crisis. When you're giving us steroids, what are we turning our patient into? Cushing. Number 6, you added, you monitor for Cushing. What are we monitoring patient here? For Cushing. Is Addison patients are what? They have low steroids. And what is the word I said also to know? The word is cortisol. What is the part of adrenal gland is affected? Is the cortex. And what is the adrenal gland is producing? Is everyone should know the word glucocorticoid, mineral corticoid, and androgen. Now what is Addison? All the steroids are low. And what are these patients are lacking here? In your mind, without our books, is number one, they have very low sodium. They have very low sugar. And what is the patient's blood pressure? Is very low. What are we going to assess here? The blood pressure. What are you going to monitor in the lab? Electrolytes. Remember, you're going to monitor the electrolytes. What would you teach your patient here is avoid the a stress. Everyone is okay? And what would you teach also? Not to stop their medication. If they stop the medication, or they're going in a stress, or they get infection, they're going into what? Crisis. What is crisis would be? That means their sodium is extremely low. Sugar is extremely low. The blood pressure is low. When your blood pressure is low, what word we call here is the shock. So remember, the patient is going into shock, and we are monitoring the sodium, we are monitoring the sugar, but remember, potassium is not good for the heart. As we monitor our patient when they're going in crisis, in what? Shock. What happened in shock? The blood pressure is very low, sodium is low, sugar is low. What is high here? Potassium. What would you do as a nurse when your patient is in crisis? Number one, you got to give the medication. And what are we going to give here? Steroids. And how would you give steroids are, write down the word IV. And what would you give? Their sugar is low and their sodium is low. We are going to give IV fluids. And what would be the sugar word is called? Dextrose. So remember the word IV, dextrose. IV normal saline. So everyone, Addison disease is from where? Adrenal gland. What part of adrenal gland? Cortex. And what is the cortex is producing are steroids, which are called glucocorticoid, mineral corticoid, and androgens. What is low here? In our mind, sodium. Lot of question would be, patient has Addison, what would you teach your patient? Avoid too much exercise in the sun or outside. Why? You will sweat more, and what would you lose more? Salt. Patient salt is very low. Patient is craving, and what food you will give? Anything containing more salt, more sugar. They have no restriction here. This is very low here. And what is high here is the potassium. And so these are your questions. What kind of skin on Addison patients we have is pigmented skin or bronze skin. They use the word bronze skin, and they're losing weight. How are we treating them, Addison patient, are by giving glucocorticoid and mineral corticoid. They can give, lot of question can be mineral corticoid and Florinef. What is low here? Everyone remember the word cortisol is for a steroid.